Welcome to this week's COVID-19 Weekly Recap for Employers. I'm Michael Bowling, a member of the Labor and Employment Group here at Crowe & Dunlevy. This week, we're going to be talking about requests for reasonable accommodation under the Americans with Disabilities Act related to COVID-19. As employers in Oklahoma and nationwide have continued to bring more and more workers back into the workplace, and as they continue to accommodate more customers in their businesses, questions about how to accommodate individuals with disabilities and their underlying health conditions related to COVID-19 are on the rise. The New York Regional Office of the Equal Employment Opportunity Commission, for example, has reported that though it has received a relatively low number of charges related to COVID-19 thus far, 100% of those charges have been related to failure to accommodate claims. And we should anticipate that these requests are going to continue to rise as more and more people come back into work. So who are you likely to hear from with respect to a reasonable accommodation request and COVID-19? Your first and most likely group are people with underlying health conditions who have a concern about complications due to COVID-19 if they were to contract the disease. The second are people with respiratory illnesses who are not able to wear a mask, where you have masks as a part of your return to work plan. And finally, you will probably get requests from people who are simply fearful of contracting the disease. Before moving on to people with underlying health conditions, let's talk about people who are simply fearful. Fear is not a disability, but it is 100% understandable that employees fear contracting the disease and the risks they run by being at work. In approaching people who simply express fear, completely unrelated to a health condition, it is important to simply talk to them about your return to work plan and the overall safety measures that you're taking to protect all of your employees. Every employer has obligations in order to protect its employees from COVID-19, and you should be following the guidance that you've received from OSHA, the CDC, and the EEOC in terms of return to work plans. And it's this type of information that you should go over in detail with people who continue to express fear. Now let's talk about people who have an underlying health condition, whether it be a respiratory illness that prevents them from wearing a mask, or somebody who's fearful of contracting the disease and the complications it might provide. In these situations, you're going to want to follow your typical process. Although COVID-19 has been unprecedented in modern history, although it has required us to rethink work and life outside of work, some things haven't changed. And one of those is the Americans with Disabilities Act. Your obligations under the ADA are no different today than they were before the pandemic. And you're going to want to follow your typical practices in terms of approaching individuals who have requested a reasonable accommodation. Typical practice probably includes requesting medical documentation related to the underlying diagnosis and the physician's recommendations for accommodation. Now, you may be saying, we've been told not to request medical documentation at this time. And that has been some pretty consistent advice from attorneys across the country. That advice was given with respect to the protected leaves under the FFCRA, the Emergency Paid Sick Leave, and the expanded FMLA. During the time that legislation was passed, it was a challenge to get into a doctor's office. But as the states reopen, doctors' offices are also reopening, and it is totally appropriate for you to request medical documentation to support an accommodations request. Now, when you get that documentation, you'll assess whether it's sufficient. If it's insufficient, you can always ask the employee to go back for more specifics. If it is sufficient, then you'll talk about reasonable accommodations. That's the interactive dialogue. You're not required to provide a particular accommodation requested by the employee or the physician. You need to look at the workplace that you have and what's reasonable for you. What might reasonable accommodations look like? Telework is one continuing reasonable accommodation. If telework is something that's appropriate for this person's position, then you should consider that. If telework is not appropriate and there's nothing that can be done within the workplace to mitigate risk, then a continued leave of absence under the ADA may be appropriate. What can be done in the workplace? You might consider what are called engineering controls. These are changes to the workplace that you make that do not require the intervention of the employee day to day. Examples of this might be additional filters in your HVAC system. It might be the plexiglass barriers that you've seen in many retail establishments. It might be having workers be in teams where they pair off when some people are in the office certain days and others are not. There are a lot of things that you can do to minimize the number of people in the workplace and their contact with each other. And even if you do not have some of these particular barriers or other changes in place for all employees, there may be something you can do for particularly vulnerable individuals. No matter what you choose to do, though, you're required to do those things that are reasonable and that are not an undue hardship. That's going to be your typical analysis and your typical approach. The one last thing I would say is don't make assumptions. That's the thing to do with regard to every reasonable accommodation request. A good example of making an assumption is knowing that somebody has an underlying health condition and deciding not to invite them back to work at this time due to your own concern for their health. That is not an appropriate assumption and can lead to a regarded as claim under the ADA. In those situations, you invite people back to work without regard to their underlying health conditions. And if someone believes that they need a reasonable accommodation, then they're going to come to you and ask. So in the end, what you'll need to do is follow your typical process, implement your return to work practices, and see who decides to ask for reasonable accommodation. And then you'll have a great interactive dialogue about what you can accommodate. We hope this information has been helpful. If you need any information or assistance related to return to work plans or reasonable accommodations, whether that be forms, typical policies, or how to approach particular situations, we're of course here and happy to help. Have a great weekend.